Hi, I'm Dr. Joe Nemeth. I am a periodontist in Southfield, Michigan, and I have another case of recession and bone loss subsequent to Invisalign orthodontic treatment. This patient came in saying she had Invisalign 2 years ago, and she's noticed that her gums are receding and her teeth seem to be getting looser. And when I looked at her mouth, there's recession down here. The recession may not look too bad, but it is much worse than it looks here because there's bone loss way beyond the recession, and these teeth are very, very loose. If they get any looser, they are going to be lost. She also noticed more recession around this tooth, which is the upper right lateral, and when I moved that tooth, again, had become so loose, any more bone loss, that tooth will be lost. So now I am going to do my best, and I do believe I will be able to save these teeth by building up that gum, doing a pinhole type of reconstruction or pinhole surgery to get thick, healthy gum tissue up here, down here, and make sure it's thick and healthy. And we may want to splint these loose teeth together because they're so loose that I'm afraid that if she bit into something, she could almost lose one. So sometimes we splint those teeth from behind to keep them strong. And this is the tooth that brought her attention to what was going on. But if you notice, there's recession here, there's recession here, there's recession here. So this is the right side. She didn't notice anything on the right side, but of course, all we have to do is look and see the recession here, the recession here, the recession here, here, all along here there's some recession, and again, that's the lower front. So really, this individual should have pinhole treatment throughout the whole mouth, because otherwise the areas that are not treated probably will continue to recede, and those teeth may become in danger even though they're not in danger right now. It's very important for me to get this message out about Invisalign and or orthodontic treatment, and very often patients are not told that this can cause recession and accompanying bone loss. So we're going to treat this patient, we're going to build up that bone, we're going to stabilize those teeth, and we're going to save those teeth, because if nothing is done, it's not going to be long before those teeth are lost. So I have a passion for saving teeth, getting people healthy, and one of the things I do is what's called a pinhole technique. We also use a laser when there's infection, but that's not the case here. So we'd love to hear from you. We'd love comments. We'd love questions. What do you think about what I just talked about? Subscribe to our YouTube channel. But remember, once again, if your mouth isn't healthy, you cannot be as healthy as you can be. And it can take years off your life if your gums are not healthy. So make sure your gums are healthy. Most importantly, try to have a good day. Please take care.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.